The number one question I get on my social media is, how can I get bigger? How can I get longer? Or, how can I get more girth? Well, today I am going to address those questions and give you the evidence behind penile lengthening treatments. If you like what you see here, make sure you subscribe so you can see new videos. What exactly is the normal penile length? Did you guys know that they did a survey of 50,000 heterosexual men? What they found was that 55% of them were unhappy with the way their penis looked. When they asked those men's partners, 85% of women were satisfied with the way their partner's genitals looked. But at the end of the day, it matters how you feel about your appearance. There's a lot of issues with that because pornography has really blurred the lines of what exactly is normal. I made a video previously talking about the average penile length. An average penile length, if you look at all the data, is approximately 5.2 inches or 13.2 centimeters. It's normal for penile length to be within 2.5 standard deviations of that, either greater or smaller. So, what's considered abnormal in terms of being too short would be anything less than 2.9 inches or 7.5 centimeters. That's called micropenis. Micropenis is prevalent in less than 1%, actually 0.14% of the population. So, it's extremely rare. It can be due to a number of causes, which can include congenital abnormalities, hormonal abnormalities, previous surgeries, or cancer. But today we're going to talk about people who have a normal penile length. Small penis anxiety, what it is and what it does. While it is true that the large majority of people who are concerned with the size of their penis have a normal penile length based on these numbers, the true issue is that a significant portion of men can have distress related to the idea that their penis is not as long as they desire. This is a form of body dysmorphic disorder, and it actually has a term, small penis anxiety. It doesn't mean that they have a small penis, but they have anxiety related to the belief that the size of their penis is not long enough. The way this is defined is that people have a preoccupation or obsession with the size of their penis, to the extent that they spend over 1 hour a day thinking about this. Some of these men can be so distraught that it affects their activities of daily living, and some can end up in the hospital due to overwhelming obsession or even have suicidal ideation. This is not a joke. This is serious. This can have real, serious complications for people. So I think it's important to talk about this, because this is part of men's health. The other major issue with this problem is that if you Google, "How am I going to make my penis longer?" you'll be inundated with tons and tons of websites and information that may or may not be reputable. Many people will go abroad or find non-licensed providers to do things to them that can have dramatic consequences. So please don't do that. Look for a reputable urologist or psychologist to help you with these issues. I will also preface the rest of the information I'm going to share in this video by telling you that the Sexual Medicine Society of North America states that procedures for penile lengthening or girth enhancement are not recommended and considered experimental unless in the context of someone who has a micropenis. The things I'm about to tell you are in the urology literature and have some data to support them. However, before doing any of these things, please establish care with a urologist who is familiar with them. As a caveat, I do not discuss or offer treatment for penile lengthening in my practice, but because this is such an important topic, I went ahead and did the research for you guys. Surgical and non-surgical treatments for penile lengthening. There are 2 categories of treatment options available to people who suffer from small penis anxiety or distress due to the belief that their penis is smaller than normal. Non-surgical treatments and surgical options reported in the literature. Non-surgical treatments, psychological counseling. There are validated measures, questionnaires, and assessments that can help you understand what normal penile size is and also help you deal with anxious feelings. Interestingly, When people have undergone just psychological counseling, nothing else, the large majority of men no longer want to look for any other treatment, whether non-surgical or surgical, to enhance the length of their penis. So this is big. I would recommend anyone suffering from anxiety to please seek psychological care. Other non-surgical options include 2. Penile extenders. 3. Vacuum erection devices. 4. Penile injectable treatments. The only one of these that has any data to suggest it actually results in penile length enhancement is penile extenders. Penile extenders are essentially a device that has a hole in which you put the penis, as well as 2 metal rods. So, what was the end gain after months of daily use? About 2 centimeters. There was a gain, but it was very small and required extreme compliance. Complications can include numbness, bruising, or lack of efficacy, meaning you could spend all that time and see no benefit. This is the only method shown in the literature to have consistently good results with very low side effects. Other non-surgical options, vacuum erection devices. These did not increase penile length. Penile injections. A number of substances have been tried, but many have had devastating complications. I do not recommend doing any penile injections. In fact, next week I'll talk about the history of penile injections. What's worked, what hasn't. Currently, the data is not strong enough to recommend any kind of penile injection. Complications have been reported even 40 years after injection. So please, do not inject anything into your penis. Surgical treatments. A lot of different surgical options have been discussed in the literature. One of the most common is suspensory ligament incision. The penis is held to the pubic bone by a ligament. By releasing that ligament, a small amount of length can be gained. However, this is not without complications. Other surgical techniques include using flaps, grafts, and even rib cartilage to increase penile length. But all of these have poor outcomes and low satisfaction rates. Studies done on these surgeries have not been rigorously reported, so currently we cannot recommend surgery to increase penile length due to the multitude of complications. The only time you should proceed with any surgery is in the context of a clinical trial. A clinical trial is conducted at an institution with an Institutional Review Board, IRB. The IRB ensures the study is safe, ethical, has data monitoring documents adverse events, publishes accurate data in the literature. This way, urologists can assess results properly. For example, 100 patients underwent the surgery. Only 10 had minor complications, while 20 had major ones. That's how we know whether something is safe or not. Conclusion. There's not a lot you can do to change the length you were given. You can gain a small amount, about 2 centimeters, with penile traction therapy, which has been shown in literature. However, many other things are still under investigation and are not recommended for routine care. First and foremost, get treatment under the care of a psychologist to help deal with anxiety before doing anything irreversible, which could leave you with something disfigured, non-functional, and worse than what you started with. Thank you so much for watching. Make sure you join me next week on Monday when I talk about penile injections and what are some of the side effects and complications that have happened in patients who've injected their penis or gotten it injected with various substances. And always remember to take care of yourself because you're worth it.